Hey there, it's Dr. Brian McKay, Core Health and Darien. Today, let's discuss arthritis. How exciting is arthritis? Well, if you have it, it's not exciting. And basically, it's really the type of thing that you really rather not get. But arthritis is basically it's wearing away of the joint. Okay, the joint is where two bones come together. Um, the three most common, there's hundreds of different arthritis. You have osteoarthritis, which is the most common one, where you have, it hurts your knees. Uh, you get arthritis in the spine, say the neck area, low back, sometimes thoracic area. But, anywhere, you can get arthritis in the hands. But most of the arthritis in the hands going to come from rheumatoid arthritis. Now, osteo is bone, rheumatoid arthritis more relates to it's autoimmune disease, and it means that your own system attacks parts of the body, especially the joints, and so it's a pretty bad arthritis basically. I mean, you'll see tons of commercials on TV. The cost of the treatment for rheumatoid arthritis could be something. The heavy duty ones could be $15,000-$16,000 a month. So we're talking about a very, very serious disease and at different levels. I mean, they found like methotrexate, which is a cancer medication, is one particular drug that does help rheumatoid arthritis, and it's crazy expensive. But you're taking a cancer drug for an autoimmune disease. But I mean, listen, if you're in the kind of pain, because it affects the joints, so you'll see the people with rheumatoid, you'll see the hands present as being mangled, and or the feet is just all distorted, like something, like something wrong with your eyes when you see it. So rheumatoid is a very, very serious condition, autoimmune, it's hereditary. Um, I would have to say um, rheumatoid is probably the worst type of arthritis. Osteo is the most common, um, but it's very, very painful, very painful. And psoriatic is another arthritis that affects the skin and the joints. But it's not as bad as a rheumatoid arthritis. So psoriasis. You hear people talking about psoriasis. That's advertised constantly on TV these days. So when you hear about people, psoriasis, that's one of the comorbidities of psoriatic arthritis. Um, so people look for, if you have a basic type of, here's the way people treat it. Um, Non-steroidal anti-inflammatories can relieve pain and reduce inflammation. So your Advil, your Aleve, your Tylenol, commonly prescribed for regular osteoarthritis. Steroids in some cases. Steroids be more likely for psoriatic or rheumatoid, um, but not so much for osteoarthritis. The biological agents are the ones you see on TV, and I cannot even pronounce the name. But if you see it advertised on TV, chances are it's the biologic when it's talking about rheumatoid arthritis or psoriatic arthritis, and that's terribly expensive, terribly, terribly expensive. So hopefully you don't have to, you won't have to do that. So not all arthritis hurt the same. That's the you know regular arthritis, the pain can come and go, and pain stiffness, you know. But there's some arthritis present with swelling or inflammation, and that's more like the psoriatic. Like the skin over the joint may appear to be, um, you know, maybe you feel a heat. Okay, so gout is a type of arthritis as well. And here's the basic things to prevent arthritis: maintain a healthy weight, don't smoke, quit smoking, avoid injuries, which we all should do, but don't always. Um, you know, you just want to take precaution. I think too is fish oil, essential fatty acids in the form of omega 3s are really, really helpful. Really helpful. You wouldn't drive your car very long without oil. I don't think you should go without what type of lubricant. The fish oil is like a lubricant. It will help with the wear, decrease the wear and tear that osteoarthritis typically does. It kind of breaks down the surface, the articular surface, the cartilage breaks down. And then so every time you move, it's going to be painful. But if you have more lubricant, in the body, the form of essential fatty acids, which is essentially an oil, it does help with the production of synovial fluid as well. Topic I discussed a few weeks ago on my podcast. Um, so, here's a question I do get a lot: does sugar make arthritis worse? And it does. Okay, and it's one of those things that if you cut out, sugars being or refined carbs like white flour, processed foods, it can help reduce your pain. So it's one of the things you got to think about because it's one thing to pop an Advil relief and you're constantly doing that. You know, um, you think about it. You reduce the amount of fried and processed food. Um, that's a sugar and refined carbs. Dairy products can contribute to, in some cases, alcohol and tobacco. Salt and preservatives, corn oil. So these are all things that you can do yourself, but that's common sense. Limit these, and you feel a lot better anyhow. Um, Arthritis is something that a lot of it can't be helped, but osteoarthritis, once you have it, it's not going to go away. And even as a chiropractor, I want to claim myself the world's best chiropractor, which I'm not. But even as a good chiropractor, you're not going to get arthritis to go away. You at best can slow the progress. Think of a snowball rolling downhill. It's going to get worse, going to get worse, going to get worse. Well, the idea here is just you can make it better by taking the biomechanical stress off the joints and by mobilizing the joints because arthritis is basically several things. One, wearing away the end plate, pain, and lack of mobility. So if you increase mobility, you're going to decrease the pain and the stress on the plate on the articular surface. So chiropractic does play a role with it. And actually, for the mild early stage of arthritis, it's probably the single best thing you could do. I mean, physical therapy is good for movement, but if that joint's stuck out of place, that's why you got to come see your chiropractor. Don't be afraid to come see us. We help a lot of people. All right, listen, it's Dr. Brian McKay, Core Health and Darien, also the Back Pain Project. I'm glad you're listening. Hopefully you learned something today about arthritis. Have a great day.